Welcome back. Matt Templeman in this morning for Sean Cuellar. The American Heart Association and the American College of Cardiology released new guidelines that will change the way doctors treat cholesterol. The new guidelines recommend doctors prescribe statin drugs like Lipitor and Crestor to about twice as many people as currently take them. Earlier, we talked with Dr. Richard Besser, Chief Health and Medical Editor for ABC News, about these new guidelines. Well, Dr. Besser, thank you for joining us today. Who, I guess, at this point is considered a candidate for these statins?
Well, I mean, this is a huge change. It used to be that only people with high cholesterol or people who'd had a heart attack were put on statins. The new guidelines say, in addition to those groups, anyone with diabetes who's 40 to 75, or anyone who has a 10-year risk of having a heart attack or stroke that's at least 7.5%. And they put out this new risk calculator to figure that out, that includes factors like your age, your sex, your race, whether you have high blood pressure, high cholesterol, diabetes, whether you're a smoker. You put all that information in, and it kicks out a number that tells you in the next 10 years how likely it is you're going to be that you'll have a heart attack. If it's 7.5% or higher, the recommendation is drug.
Okay. Can medications alone get rid of these health risks that are associated with high cholesterol?
Well, you know, each of those factors can be addressed in different ways. The thing that will address all of those factors is making sure you have a healthy weight, eating a heart-healthy diet, and getting regular exercise. If you do that, it will help control your blood pressure, it will help control diabetes, it will lower, in a big way, your heart disease risk. And for some people, it will mean that you may not need to take a drug at all.
So if we do lower these risks, what about the side effects? There's always side effects with these things.
Yeah, drugs have side effects. I worry, you know, that we're now going to be at the point where 1 out of every 3 adults is taking a statin. They're very safe drugs, but there are some people, about 5%, who experience muscle pain. 5% of millions and millions of people is a lot of people with muscle pain. Some people will have increased risk of diabetes and some liver problems. So we are going to see more of that, but it's offset, hopefully, by lives saved from heart disease.
And as well, we have to eat healthy and exercise as well. Dr. Besser, thank you so much for your time. We do appreciate your input.
My pleasure.